Good evening, everybody. Welcome to another installment of Medical Talk in Layman's Terms with Nurse Charlene. And of course, I'm Nurse Charlene, here to bring you some good old fashioned information about your health and well being and everything. And tonight's subject, I got to tell you why I picked it and everything and stuff. But tonight's subject is pros and cons of sugar, salt, fats, and electrolytes and stuff. So, of course, I'm gonna explain what sugar and salt, you could kind of guess those, and electrolytes mean, though, and fats mean, and everything and stuff. So, I'm gonna break them down into little bite sized pieces so that everybody, even somebody in the medical field, of course, gonna understand, but somebody that's not in the medical field, know nothing about that, they can actually understand also. So welcome on in, you guys out there in social media land, and I'm gonna go ahead and get started pretty soon. But in the meantime, I just want to come on and just let you know, yeah, with all this being said and stuff, we just gotta start grabbing on to our health and everything. Where it's so much stuff out there that I'm seeing as a nurse. So I'm on both sides of the equator, when it's talking about health and then talking about the real world and stuff. People are catching this late. You're seeing lots of celebrities. They're on, in this dying, trying to put somebody else on and stuff. They're in this, and they're dying and stuff like that, and it's just really bad out there. And if you're not paying attention, you might be the one on the expiration list, meaning you're gonna be going home, and stuff. And it's all because of something simple, and stuff. Your body is not gonna just whoop you all at once. It's gonna give you a couple little, hey, hey you, hey you, man or woman, and so hey, how you doing? I'm in here and I can see some things that they starting up. Oh, you don't want to listen? Oh, okay, I'm not important enough. Okay, I'm gonna get a friend and stuff, and then they come back with their little friend, and then they looking at you, and they like, hey, I got my friend here. Hey, what's up? What's up? And so yeah, you're not listening. Okay, we're gonna get one more friend, and then we're gonna lay you out. And guess what? If you're it's not about me being a nurse, it's not about you not being a nurse, it's not about the doctor being a doctor, because guess what, if you're human, you can get it, you can get it, you can get it. So that's what's really important and stuff. And we seem to lose track of that and stuff. My body is a temple and stuff. Do you really treat it like a temple? Or do you Tylenol it? Do you Alka-Seltzer it? Do you Mucinex it? Do you NyQuil it? Do you CMOS it and you don't know where the CMOS came from? What are we doing? It's all of us. I'm not talking about just you. I'm saying I'm talking to you, but I'm talking to me too at the same time. It's no joke. And it gets a little rough, and everything and stuff. So you gotta know what you're doing. You gotta know that our bodies are gifts and that we need to start taking care of them, definitely, and stuff. So before I go any deeper than that into this subject tonight, which is pros and cons of salt, sugar, and fats, and your electrolytes, which means your sodium, which is the salt, potassium levels, calcium levels, magnesium levels. What is that doing? What are those, and stuff like that? Well, I probably can't explain them in perfect, simpleness and stuff, but enough that you'll get the point and stuff and why. And what it does to you will surprise you. So I'm going to go ahead and read my podcast disclaimer. Y'all come on in and stuff. I know I text a few people and stuff, but just in case, I don't know if today is some type of holiday also and stuff, but y'all come on in. And if you don't, okay, just long as I talk to one person and I help them, I helped enough and stuff. I did my job and everything. So I'm going to read my podcast disclaimer. And it says, this podcast is for educational and informational purposes only. While Nurse Charlene, which is me, is a licensed registered nurse with extensive healthcare experience, the information shared here is not intended to replace professional medical advice, diagnosis, or treatment. Every person is different. What works for one individual may not be right for another. Always consult your doctor, nurse practitioner, or qualified healthcare provider with any questions you may have regarding a medical condition or before making changes to your health, your medication, or your lifestyle. Before you make the change, you consult with the doctor first. Okay, that's been seeing you. They know your history, or hopefully they do, and everything. If you think you may have a medical emergency, call 911 or seek immediate medical attention. The views shared on this podcast are based on professional experience and general knowledge, presented in layman's terms, meaning keeping it simple to help bridge the gap between healthcare and everyday understanding. By listening to this podcast, you acknowledge and agree that this is not a substitute for personalized medical care. Okay, that's for one. Number two, no provider patient relationship is established, and you are responsible for your own health decisions. You should be, and stuff. It's you. You should be responsible for them. And remember, your body speaks. Your body's a snitch. Believe it. Listen to it. Respect it. And when in doubt, check it out with a medical professional, your doctor. Thank you for tuning in and taking a step towards better understanding of your health. Thank you, guys. Yes, so that's the podcast disclaimer. And I do that so that I stay legally in tune and everything. I had a friend of mine that I saw. Welcome on in, Mama Rena, my little auntie and stuff. She said, hello, beautiful. Well, hello, beautiful to you. Thank you so much. Thank you for joining in. And Rosie Granny Allen, thank you for coming on in. She says she watching and everything because this pertains to all of us. The topic tonight is pros and cons of your salt and sugar. I just left it out instead of your glucose and your, sodium and all of that. Salt and sugar and your electrolytes like potassium, your sodium, your calcium, your magnesium and stuff. So welcome on in, ladies and stuff. I just got started. So what I like to do is once I get in and stuff like that, I want to start giving you the definition so that you know what we're talking about and stuff. That's very important and stuff. And so my introduction. Every single day, your body depends on sugar, salt, fat, and electrolytes to survive. Your body depends on these. Oh, don't be eating sugar or don't be eating all that salt. Don't be adding no salt and stuff. Wait, why are you saying that? Because somebody messed around and found out? Yeah, probably and stuff. Or somebody got diabetes or somebody got high blood pressure, huh? Because there got to be something that's stopping you from saying it. And so that's why I'm saying we need these things. So it's not like we don't need them and stuff. It's that we need them, but in a certain amount and stuff. And I'm gonna say some stuff tonight that's probably gonna blow your mind because it blew mine as I studied up on it. Like, oh my God, you'll see and everything. So let me go ahead and finish. These substances are not automatically bad. In fact, the body needs them, which is your sugar, salt, fats, and electrolytes to survive and stuff. Your body does need them. So they're not just initially bad. It's how much you do, how much you put in there Rosie Granny Allen is watching. Okay. Yes, ma'am. Thank you very much. I love you, mom, and stuff. In fact, the body needs them. The problems begin when we get too much or too little or the wrong kind of it, the wrong kind of fat. We need fat, but not the not the cholesterol fat. We need the good kind of fat because it actually helps us. And you'll find out as I read on and everything. So your body constantly sends warning signs when something is off. So this is your body is trying to tell you and stuff. Welcome on in, Miss Maria, my cousin Maria. She said hello, everybody, and hello to you. Thank you for coming on. And she said your body is a snitch. That's right. And I got a couple quotes because it's for this time, which is what we're talking about. And this is what this is all signaled around food. How many of us need food? From little babies on up. Probably everybody. Animals and trees, plants. Everybody needs something. So when I'm saying this, I'm saying this is really important. I know it sounds like that. And, I got my little board because I always got to give you visual cues to keep you going, and stuff because we got to see stuff. So I did a fake water bottle. Yeah, I don't know what kind it is, what brand. And then I did a Gatorade, because it has electrolytes. We talking about electrolytes, and stuff. Now, is it enough? We'll beg to differ and stuff. But I'm gonna leave you with some information that'll make you actually look up Gatorade to see how much is really in that bottle, and everything. Welcome on in, Raina. She said, hey, sis, and everybody else on there, welcome on in, my dear. Thank you for coming on. I'm talking about electrolytes, and this is for everybody, from the kids, the babies on up to grown folks and our seniors and everything else and stuff. We all need food. We just don't need how much we eat normally and stuff. So we just got to learn how to do that, how to adapt, how to get it together and stuff. And that's what I'm talking about tonight and stuff. So I want to give you a couple quotes from Your Body is a Snitch, Believe It. And that is, too much sugar today can become diabetes tomorrow. Ooh, that's cold, huh? Too much sugar today can become diabetes tomorrow. Salt may flavor your food, but too much salt can pressure your heart, give you high blood pressure. You see how it might sound haterish, but it's telling you the truth. Listen to it. Okay. Not all fats are enemies. Some protect your brain and your heart. So you can have fat because it protects your brain and your heart. You want to protect it, right? And stuff. But if you eat the wrong ones, you come down with some other stuff that wasn't on the menu. It wasn't, you didn't get the memo for. I didn't get the memo for and everything. When your electrolytes are off, your body will tell you fast. It's going to tell you because you're going to find out and stuff. And we're going to talk about it. I'm going to tell you why I said that. Okay. Your cravings, your fatigue, being extra tired, your swelling, edema, some people might know it as, or swelling in them ankles and stuff like that. They won't go down. My feet won't go down and stuff. I got to put them up, elevate them, put them up with some pillows under your feet and all of that stuff. It's a reason behind that. It shouldn't just do it. So if it is doing it, something is wrong. Something is off. Okay. And then the biggest one, the body whispers before it screams. Listen early or die early, and stuff. Even me, the nerd. Yeah, mine be snitching. I don't like it all the time, but it tell me what. Do I like the end part when I get diabetes, convert to diabetes? Do I like the end part when I'm fatigued, extra tired, and I can't even put one foot in front of the other no more, and stuff? Am I gonna get it then when I got blurry vision or dizziness, and I can't stand up. I can't have fun anymore and stuff because this is wrong with me. This is wrong with me. My blood pressure too high. So I'm getting headaches all day long and stuff. I'm cramping. My teeth are sticking to my gums and stuff because I don't have enough hydration. I'm constipated. I sat on the toilet 1 hour and one little tiny pellet came out. You supposed to have a turd. You sat on the toilet for an hour and nothing came out? Yeah. That bad boy's supposed to come out. It's trash. Just like you take out the trash every week and stuff. It's trash, or whatever and stuff. So I'm saying all of this to say all of it makes sense, like your daily habits, your daily things. The bills need to be paid. You use them. And so you didn't say that when you was scrolling. You didn't say that when you was charging it up. You didn't say that when you ran that bath water. Okay. So we got to maintain this body because it's the only one we get. You don't get a body transplant. You might get a heart transplant. You might get a lung transplant sometime, or a kidney transplant or something like that. You don't get a body one. Who got a body one? Exactly. Sci-fi, Get Out, one of the movies or something like that. But yeah, name me one person and stuff, and then you ahead of the game and stuff. So that's where that comes from. So guess what? What is sugar? I want to know that too. Yeah. What is sugar? Sugar is a carbohydrate. I know, big old giant word. Sugar is sugar. It's sweet and stuff. But sugar is the thing that gives your body energy. It fuels the brain, the muscles, and the organs. The brain, we think of it up here, but we got two brains. We got a brain up here and we got a brain in our gut. So we got two brains, but the brain is your control center. That's what helps you think. That's what helps you do what you do and stuff like that. Even when you stop knowing how to do it and stuff, and you got dementia and you can't remember and stuff like that, your brain is your control center. No brain, no life anyway, and everything. So it fuels the brain. It fuels your muscles. How do you get up? How can you push yourself up if you have no muscles? How can you raise your arm if you don't even have control over your muscles, and stuff like that? So you need all these things and stuff. Your organs, skin is an organ, a big giant organ. Your heart is an organ. Your liver is an organ. Your stomach is an organ. It's organs all over your body. That's why they say the organs are shutting down. That means somebody getting ready to go home and not to their house, to Operation Heaven or Hell or wherever in between and stuff. But that's where that comes from, and stuff. So it's very important and everything and stuff. And so there's some types of sugar. There's natural sugar. So just remember this when I'm saying our body needs certain sugars. But look at what I'm talking about and stuff. So natural sugars, there's a natural one. That means it's just automatically comes within that type of food or something like that. And they're found in fruits, in milks, and vegetables. So that's why they say eat your daily amount of fruits and vegetables and blah, 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 hey, and stuff like that, because that's where you get your healthy sugars from, or natural sugars from. And those are usually the easiest for your body to do something with. Because if you're eating a fruit, it's getting other things, fibers and different things, but it's also getting that sugar from there. It's a natural one, not a man-made one, and everything and stuff. So that's where that comes from. Natural, and then it's the other kind and stuff. So we'll go on to the other kind. The other kind is called added sugar. So you got natural sugar that come from a fruit or a vegetable or some milk or something like that and everything. Then you got the other kind that happens during processing. We're really finicky about what we eat. So even though you think you're eating super well and stuff, you got to look at what it is that you're eating. I don't eat none of this and none of that and stuff like that. I get it. But it come from somewhere, and so that's what we call processing. This is where somebody in a lab got together and start putting this on the food or that on the food and stuff like that. So you're not even getting legitimate food. Even me. Yep. Yep. And that's where that goes in at. So added during processing, and this is the added sugar, the kind of bad sugar, and that will be candy. Snicker tastes good, right? Those Twix and I don't know, Twinkies and stuff, they taste good, candy, and stuff like that and stuff. So those Peeps or something like that, yeah, those came from heaven or something, right? No, wrong and stuff. So sugar is bad, but we still eat it, or we have ate it before. Soda, because Coke tastes good, and also I like what was that? Somebody might know this that might be coming on and stuff. The Manzalot or whatever, apple soda and stuff. Yeah, it got an apple in it, so that that's good, right? Okay. But anyway, cakes. So candy, soda, cakes. Pound cake. That I know God make pound cakes and stuff because they're nice and soft and everything and stuff, and they taste really good when you eat it and stuff. So it got to be good, right? Okay, and stuff. Cookies. I know whoever invented chocolate chip cookies, they knew the right thing and stuff. I know they got natural sugar in there, and I know that they are very healthy and stuff if you eat cookies, especially chocolate chip, right? Or oatmeal, because it got oatmeals in it, and stuff like that. So I know that one. Okay. I'm just trying to be the devil advocate. Oh, sweet tea. It's tea in there. It's tea. Okay, it's sweet, but it's tea. That got to be healthy. All the little old ladies and old men and stuff drink their little tea at tea time, tea parties and stuff. That's natural and stuff. Yeah, I didn't know tea comes with what is it, without with sugar already in it, or you had to add the sugar. But the sugar that you added, who made that? It just popped up in one of them 5-pound bags or 10-pound bags. Okay. I'm just saying. Energy drink. They give us energy so we can do more, and stuff. So we could run around and pick up and clean up faster and do good at our jobs and everything and take care of the kids just perfect and stuff. Like, I know the energy drinks are good and stuff because they help keep you up. They give you a burst of energy and stuff. And that's what you need. Sugar is energy, right? And stuff. Not that one. Yeah. So you see where I'm going with this. I'm just, I'm doing a little devil advocate and stuff and everything. Everything I said about them is not the truth. Cake didn't come from heaven. Pound cake didn't come from heaven. Chocolate chip cookies didn't come nowhere near heaven and stuff like that. They taste good. You gonna eat them, and stuff like that. The kids like them. They shut up when you give it to them and put them in front of the TV and let them watch cartoon. It got to be good, right? Okay. There is a pro of sugar, not the ones that I just said, processed sugar, but there is a pro of having sugar. It gives quick energy. Okay. So that's a pro if you do it in moderation. If you don't overdo it, meaning, like don't do too much, you might can win and stuff. That's where that comes in. Exactly. Cousin Maria said the key is moderation. That is exactly it. It's moderation and stuff. So then it gives quick energy. It helps the brain function. The brain needs sugar, not a whole cake, but it needs sugar. So that wasn't wrong. It just don't need as much as we give it and stuff. Even me. Okay. And stuff. It prevents low blood sugar. If you don't eat sugar at all, which I don't know, but starving or something or fasting, whatever it might be and stuff, how can you prevent a low blood sugar? Is you got to put something in. So you got to have some type of sugar, just not in excess, and stuff. So that is in moderation, like Maria said. Thank you, Maria, and stuff. And it's important during illnesses and or exercise. Like it's important to give you some energy during illnesses because your body is already fighting whatever it is, the cold, the flu, the stomach flu, food poisoning, whatever the illness is and stuff. It's fighting that already. So it need that energy. And them fighter cells, they need a little sugar to get on down, and stuff. And because Maria said sugar from natural sources. So you're okay. I want to put that one up. Sugar from natural sources so your body can process it. Exactly. Natural sources are your best sources. So you can have sugar. So sugar can be in bananas. They can be in strawberries and stuff like that. They can be in apples. But guess where it goes in? It's not in moderation. A caramel apple, a strawberry shortcake with the little cups, and you take the strawberries, cut them all up and stuff, and drop you some sugar on them and stuff like that, and make your little simple syrup with them and stuff like that. And then you put some whipped cream on there because whipped cream that had to come from a good place. That came from paradise and stuff like that. So you put that whipped cream on there and stuff. A couple strawberries washed off really good and stuff, and chewing on those, and you get some sugar, or you make it into a strawberry shortcake because strawberry shortcake is the best thing ever in the world, right? No, and stuff. But you see where I'm going with this and stuff. What I'm trying to say is moderation, moderation, and everybody is guilty of doing it not in moderation, but overdoing it and everything. And so the other thing is natural sources will be your fruits and vegetables, dates and maple syrup and honey. So there's actual, yes, your raw honeys and stuff like that come from nature. You got a better chance at living with those than living with the kind that they process. You don't know where that white cocaine came from. I mean, sugar came from, and stuff inside them granulations. And that, yeah, the cocaine. I mean, sugar, and stuff like that. You don't know where that came from. Who made it? What chemist? CNH, pure cane sugar. Yeah. Pure processed sugar. But anyway, I'm saying all of that to say that that's one of the things and stuff. Also, some of the pros of sugar is important during illness and exercise. I told you, and having the energy to exercise. That's what I want to make sure I said and stuff. And then also, natural sugars contain vitamins and fiber. So you can actually eat enough of those to help push that turd that I said was stuck because you was constipated or something. It actually let the little turd come on out. But the natural way is when we put that other sugar and make that strawberry shortcake, or the crossover, make that not just banana, but banana pudding. Yeah, you see what I'm saying? Banana pudding and stuff, because that came from somewhere in paradise too and stuff like that. So you see what I'm getting at? A banana or banana pudding. I mean, I know vanilla wafers, they probably have some fiber in them, right? Y'all look it up and tell me if y'all know if it got fiber in it or anything healthy and stuff, because that's where that came from. Okay. And stuff. So then we got what else we got? The cons. The problem with sugar. This is what happens when we do the opposite, and why a million people are pre-diabetic, which means another form of just getting them diabetes, and stuff, unless you reverse it. Okay. And that would be health problems related to too much sugar. The top illnesses that they have for if you eat too much sugar, especially the processed sugar, the top illnesses is type 2 diabetes. Yeah, you don't get that when you was born. You get that from getting older, sometimes even in the teens and stuff. Too many Takis, too many flaming hot Cheetos, too many Twinkies and ho-hos and honey buns and all the other stuff that's out there with no stop button and stuff like that. So you got your type 2 diabetes. Then you got your obesity. That means overweight. Period. It doesn't mean nothing else. Obesity means that you big, you're fat, and stuff, and not just regular fat. You fat and stuff. That's where that comes from and stuff. Heart disease. So heart disease comes from um high blood pressure. It starts with high blood pressure, but then high blood pressure it morphs into congestive heart failure, heart attacks, strokes. It does all of that stuff. High blood pressure. You see what I'm saying? And sugar can mess with your blood pressure and everything. And it definitely causes illnesses that have to do with heart disease, like congestive heart failure, coronary artery disease. That means your clogged arteries that feed your heart blood. Your heart need blood or it's not working. It's not going to do what you need it to do. Okay. And stuff. So then you got another one is called fatty liver disease, and that's your liver, and your liver in diabetic people and stuff, it'll tend to start giving you a fatty liver over time. But it's all mixed in with obesity, diabetes, heart disease, and all of that. And then you got you some fatty liver. And the main thing I said, we're talking about food because guess what? The food we put in our mouth usually has something in it: potassium, sodium, magnesium, calcium, and sometimes it don't have none of them in there, and stuff. Most of the time it don't and stuff. But in the meantime, tooth decay. That means, yeah, I need them. You gonna take my fronts out? Oh, you gonna? Oh, all of them. You gonna take all my teeth? Oh. I thought I needed them. Don't they make you look cute or something? I think. Yeah. It's better than smiling and it's just gums. I'm just saying, and stuff. So when I'm saying this, not to talk about anybody in particular, I'm saying you probably need your teeth. How do you chew? You can't wait for the baby to cut their little teeth so that they can start chewing some stuff, and everything. You start giving them cookies and little puff balls and stuff. They're processed, but okay. And stuff. I'm saying all of this to say we need them. We need our teeth. And too much sugar causes tooth decay, which causes us to have problems. How many have had problems from tooth decay, cavities, what else? Root canals and all of that. Just in case nobody else, that's what happened to these little chompers and stuff. They didn't got beat up, they didn't got braces, they didn't got, they took a licking. And they might not keep on ticking, give me about 10 more years, 20 more years. They might not be ticking, and stuff. So I'm just saying, and everything. That's where it comes from. So too much sugar also puts you at risk for certain things. And the risk and causes of these things are stuff like what would make you sick from too much sugar would be too many sugary drinks. Soda tastes good. What the? Shut up. And stuff. Oh, Lipton peach tea. They put a peach in there, so mine is flavored by the peach. Yeah, if it was really a peach in there and stuff. Yeah, and stuff. It's not happening. It's not happening. No matter how wishful thinking and everything and stuff, it's not happening. Thank you, ladies. Rosie Granny Allen said, "You're going deep. Teach in Jesus' name. Amen." Thank you, Mom. And stuff. She said, "Teach" and stuff. What I'm trying to do is just let you know that we know. And I didn't say I didn't make the mistakes. I didn't lost teeth too. I faith around and found out. Yeah, and stuff that it get down, and stuff. But that's why. And you need teeth to eat and to properly it's called maceration, but to properly chew your food down to a level that you can swallow it. Because if you put the whole Twinkie in whole and you didn't even chew it down and break it down, it ain't gonna go down your throat. It'll probably choke you to death and almost kill you. But yeah, you got to chew it down to a certain amount and then you swallow it down. They go down into that food tube, and then that food tube scoots it down and rocks and rolls and scoots it on down. Then the flapper open up and it drop off into your stomach. Your stomach got acid in it. Your stomach, the acid eats away at the food and stuff and everything, and it prepares it for the rest of the little journey and stuff in your gastrointestinal system. So then it hits that after it hits a couple departments and stuff, department stores and stuff, it goes right to them small intestines. Them small intestines, they pull out what they can and stuff, and pull out all the good stuff that they possibly can and stuff before sending it on to that large intestine. That large intestine is still be working it out and stuff, but it's preparing for the turd. Now I'm getting the trash, and stuff, but it'll still process it a little bit more and find that one last element, one of them little calciums, one of them little sodiums, one of them little potassiums and stuff. And then it break it down and stuff, get it ready for a turd and stuff, and then so on and so forth. And then you drop a load, hopefully, unless you did something wrong and stuff along the way. And that turd just stopped right there and said, I ain't letting no more dookie through. And I'm just saying, because I got to teach in simple terms. It's layman's terms. So that's where that comes in at. Yeah, sometimes constipation is called a player hater turd that didn't get fully digested properly and stuff. It's sitting up in there like a little piece of little rock or cement and stuff. And it's like, I ain't letting no more dookie through until you do something to make this one, and stuff like that. So you got to put your fiber in, all of that stuff and everything. And then you could get you a little heavy load to come out and stuff. If you don't do that, you're going to find out. You're going to find out and stuff. That's all I could say and stuff. So then, like I said, too many sugary drinks, processed food. Do you know just about probably 88% of our food is processed or man-made in some type of lab or something like that? We really got to find out where our food is coming from. And that natural doesn't even all the way fully mean natural. It just means that they didn't make it as nasty as the other people over here or the other people over there, and stuff. But when it go into that process part and stuff, it's a problem, and it's going to catch up to us. It's already have to most of us. I know somewhere along the line, it caught up to me. I'll speak for myself and stuff, but it's caught up to me and everything. Then you got your sedentary lifestyle. What the heck is a sedentary? No exercise. You don't even try. Yeah, the exercise is I will lift this Twinkie up. I will lift this soda up. Oh, I could drink a Monster and then I don't even go exercise. I could drink one of them Red Bulls and I ain't gonna even go exercise because it's sedentary. You sitting and tarrying in your seat and not walking at all. Walk that steak off. Oh, God bless me with all of this. Yeah, walk it off now. Yeah, you don't want to. Okay. Then you'll find out what that do. Or you'll find out the other way that I probably do need to exercise. And so that's what that means. A family history. So if you got a family history of diabetes, count on looking for your diabetes and do everything you can not to get it. If you got a family history of this, a family history of that and stuff, that means it's in the family. It runs in the family, and stuff. That's what that's talking about. Blue eyes running the family, hazel eyes running the family. That's what it's talking about and stuff. So then you got stress eating. Oh, I'm so stressed out. Just bring me one more bowl. Fill it up. Don't be and put everything on it. Shoot, I'm stressed. Yeah. Okay. So you get it, and so I'm stressed. So I'm gonna eat. It make me feel better when I eat, when I'm full. Then I could think straight or go to sleep and let it just digest, do what it want to do. I don't know. I'm just saying. Or poor sleep. You didn't ate so late that you can't even sleep in the middle of the night because your body still need to digest that, and you didn't cause the whole 4th of July up in there. So your stomach is, you got some little gas and some little bing, and all of that stuff. And you might even have to go number 2 or something. You probably shouldn't go number 2 at 3 o'clock in the morning if you have a normal day job. You supposed dookie in the day or dookie in the evening or something like that. You ain't supposed to dookie at 3 or 4 or 5 o'clock in the morning unless you're up and that's your time to work and do what other people do. When other people are sleeping and stuff, you're up working and doing what they do in the daytime and stuff. So it don't make any sense and stuff. And then we got symptoms that you got too much sugar in your system. Okay. And stuff. Now I'm gonna run through them now and stuff. Symptoms of it: excessive thirst, excessive hunger, excessive peeing. That's one sign that it's some trouble in your way and stuff. So that's one thing and everything and stuff. Then you got fatigue. That's being extra tired on top of your tired on top of your tired and stuff. And then you got weight gain. That means that you putting on the pounds. You almost had a flat stomach. You was almost there, and you worked real hard for it. And then something happened along the way, and next thing you know, you put on that weight and stuff. And it keep on going up, even when you exercise and stuff. Blurry vision, not being able to see. Not just the extra, because I still got my glasses right here just in case I have to faith around and find out. I'm gonna put them bad boys on and stuff. I ain't got time to be playing. I'm a human being. I make mistakes too, and stuff like that. So I'm gonna put them on when I'm ready and stuff, or when I really need them and stuff. They going on and stuff. But saying all of this to say that blurry vision, that's another sign you got too much sugar circulating in your body. Not quite this or not quite that yet, but you getting there, and stuff. So watch out and stuff, and recover from it. And then I told you to increase hunger and stuff. Increase hunger, increase thirst. So you want to drink, you want to eat, and it ain't enough and stuff. And you want to tinkle, little star. And then also for people that are already diagnosed with diabetes, slow wound healing. That's a thing. That's an actual problem and stuff. Slow wound healing is terrible and stuff. So I hope you get into what I'm saying when I'm doing this. I started with sugar and everything. I'm gonna go into all of them, but I'm gonna go a little bit faster. But I started with sugar because it was one of the main ones, and that was the first thing we got to and stuff. And the treatment for it: reduce sugary food and processed foods. That's one way of doing it and stuff. That's one way of getting to it and stuff. We got to start changing, our lifestyles and stuff. You want to breathe, don't do nothing to assault your lungs. You want to be slim and healthy and stuff. Don't do nothing to terrorize your blood sugars and halfway kill yourself. Welcome on in, my little niece, Whitney. And so she said, okay, thank you for the information tonight. Always good to know. Absolutely. I'm talking about them all: sugar and salts and fats and electrolytes and stuff. So we'll go on, but I'll make sure that you know what I'm talking about and everything. So then the next one is that was just your sugars and stuff. Another way of treating it is to know what your numbers are, to know that you actually got diabetes possibly and stuff. So pricking that finger and getting that number. If it's always high, then you got diabetes, period. If it ain't, it's always normal and stuff, then you got a chance. Before you get diabetes, you got a little chance to rock it out and stuff. And then now I'm going on, that was sugar and stuff. Oh, one more thing is portion control. So if you're eating and stuff, You don't need the biggest chicken breasts and or fried chicken breasts and stuff, the big old giant huge pterodactyl one from a falcon or a bird or eagle or something like that. Then you got your mashed potatoes and it looked like a big old mountain, Mount Everest and stuff like that. Then you got yeah, you didn't even do no vegetables. You just did some macaroni and cheese. You got a big old lump of that, and stuff like that. Cause you like, I'm gonna eat in style and stuff like that. Okay, but that style is gonna give you a style, and stuff. So that's what I'm talking about. And then treatment for diabetes also, or from sugar to high sugars and stuff, is your insulins and stuff like that, your what is it called, metformins, your glycerides, your your, they got all these different kinds of insulin. They got a long and lasting, they got a short acting that you eat with food and stuff, and then they got all the other ones in between, your 70/30s and all these funny stuff that you'll know if you had diabetes. Even if you don't know medical stuff, you'll know that one. If you ever got prescribed it, you know that you got diabetes. You know that you got high blood pressure. You know that you got you know. Okay. And then also that's it on that one and stuff. So then I'm going to salt. Salt contains sodium, which helps control fluids in your body. So you need salt. I didn't say pour the whole Morton's box on your food, or the salt and pepper, salt shaker, and stuff like that. But yeah, they have alternatives. They have garlic powder. That means it contains no salt. Onion powder. It contains no salt. No salt seasoning. It contains no salt, but all the other stuff that can flavor your food. Your food can still taste good just using natural things like natural garlic, natural this, natural that, and stuff. So there is a way to still survive without having nasty food. Well, I've been having good food all my life and stuff. Now I got to make it nasty so it can be healthy, so I won't die. Yep, yep, okay, and stuff. So salt controls your fluids. It supports your nerves. We all have nerves everywhere in our body. We want our nerves to work properly, or we have rheumatoid arthritis, sciatica, because sciatic nerve, that's what sciatica is. Neuropathy, neuropathy, nerve. You got nerves in your brain. You got nerves in every part of your body, up and down, all the way to your feet, and stuff like that. And so it's important that your nerves are healthy. They can be damaged, and that's a problem. So salt is one of the things that we need to help keep healthy nerves, but not too much, in moderation. Okay. And stuff. So that's where that comes in. And then salt also helps your muscles work. Where's your muscle? Oh, I just got a couple in my arm. They kind of flabby, but I got a couple. You got muscles there. Your heart is a muscle. If it don't beat, because your heart is a whole muscle, then it won't beat. And then what happened? If your heart doesn't beat, then what happened? You did. And stuff. So okay. And stuff. So that's where I'm going with that and stuff. And then it maintains your blood pressure. Believe it or not, in the right amount of salt in your body, it maintains your blood pressure, so your heart don't have to work so hard, because your heart is a muscle and it helps the muscles. It helps your heart. Your heart is a muscle. You see where I'm going with that and stuff. So that's where that's coming in at. So the pros of are the good things of salt. It benefits. It helps your hydration. So actually, salt can help you stay hydrated in moderation, meaning not more than enough salt and stuff, but in a certain amount and stuff. It actually helps you maintain your fluid balance, what you need, so that you don't be constipated or you don't have diarrhea and be pushing it all out and stuff. But it's the extra P tube is coming out your butt though, and stuff, instead of your part, your urinary parts and stuff. You know what I'm talking about. But anyway, and stuff. So benefits. It helps with hydration. It prevents dehydration. Yeah, the with them lipstick to them teeth because you dry. You dry. You it's supposed to be moist at least and stuff. If it's dry, you in trouble. You better figure it out and fix it, and stuff. So that's where that comes in at and everything. I hope I'm getting to you because I'm trying to tell you, but in a nice, reasonable conversation. We having a conversation and stuff. And I thank you for everybody that got on and chose they self to get this information because it might not be affecting you now, but it could down the line. It could affect your loved one that you want to keep alive. I got some loved ones I want to keep alive. They're on here with me right now. You see what I'm saying? So that's where that comes in at. So also benefits of salt. It supports your nerve signals so that they're not all damaged and firing at the wrong times and doing all of this stuff to you that cause you want to, to go almost crazy because they hurt and doing things. It's necessary for muscle contraction. Didn't I say the heart was a muscle? So if it don't go boom, boom, that's what a contraction of a heart is. Boom, boom. That's your heartbeat. What if it don't contract? Yeah, you don't live. Okay. And so I'm just saying. And then it maintains blood pressure balance, meaning it keeps you at that good number. When it's up a little bit and stuff, it's probably due to something we ate. If it's down a little or stress, we can't control it. I'm just saying, I don't care. Why you think I found out? But guess what? I say this. Well, you a nurse. You should know that already. And you a nurse. And that. No, the only difference between me and you is, yes, possibly I'm a nurse and you might not be and stuff. But at the same time, the only thing that makes me different from you, not better than you, different from you, is I'm a tell. I take it for a few. These headaches got to stop. I know they there for a reason, so I'm gonna find out. I'm gonna know what my blood. I know what my blood pressure numbers run. I know what this stuff run, and I know when to run to the doctor and tell them, hey, we got to do this, this, and this, and stuff. And my doctors like it because I'll tell them what we need. We need for me this, this, and this. Can you check my pee for this? Could you check this for this? Can you check my blood pressure again? Oh, I need to call them in every day. Yeah, because they know I'm medically inclined, so they're gonna tell me to take my blood pressure at the same time every day, and then give them the number, and stuff, and send it back and stuff like that. So that's the difference. It's not better than you. It's I tell first. I'm probably gonna tell 10 times faster than you, but I still got it. And you might not have high blood pressure, and I got high blood pressure. But I'll tell on it first. So guess what? I don't get to die from that. I don't just take some Tylenol and make the headache go away and then forget that I got high blood pressure. I actually tell on it, find out if it is that or not. And if it's not that, then I could go ahead and continue to take my pain medicine or whatever and stuff. But if I find out, then I'll take my pain medicine until I can get it to a happy medium with the medicine that they prescribe me. And I'm not too good to get a medication. The only difference then is I'll find out and wean myself off instead of staying on it for the rest of my life. And I'll make the changes I need to make so that I don't have to go through it. So that's the only difference. But everybody can do it. You just got to believe in yourself and do it and everything. So like I said, it helps maintain a blood pressure, controls fluids, supports your nerves, and helps your muscles work. Then also benefits of salt is it helps hydration, dehydration. It supports nerve signals. It's necessary for the muscles to contract, and it maintains blood pressure balance, good blood pressure. It's really real fruit in there, I think. No, it ain't. It's processed. I didn't do nothing for myself but wet my whistle. Okay. So top illnesses linked to too much salt. High blood pressure. Your blood pressure be too high. And it's linked to too much salt. I didn't say that's the only way you could get high blood pressure, but that is linked to it. That's one of the most common ways of getting high blood pressure. Also, heart failure, also known as congestive heart failure. Your heart is failing to beat at a pace that it needs to make everything get everything inside your body, because your heart is pumping its blood around. So it contracts and stuff, and then it drop in and out and stuff. The top one is atriums, and the lower ones is ventricles, and it pump boom boom and stuff, and that's a whole contraction and stuff, and then it sends that blood, good blood, um, out to your body and supplies it with nutrients, food, and it supplies it with oxygen and food and all the good stuff to keep everything alive in your body. It sends some up to your brain and stuff. So you need your heart because it sends all that good blood to your brain and everything and stuff. But it also sends it all the way down to your pinky toe. So the pinky toe stays there. It's that important. Everybody got to get they issue, and stuff. And you need to be able to do that and stuff. So that's where that comes in at. Thank you guys and stuff. I see the support. Thank you for all the little hearts and stars. I see them and everything. So the illnesses, I said hypertension, heart failure, kidney disease, our kidneys that soon may clean the blood and then produce this stuff called pee, urine, and stuff, and then they go on down out of the kidneys after they clean it up, and they take what they need and stuff. They clean blood up and stuff, take what they need and stuff, then they send them down into your bladder, and then out as pee, the trash of your genital urinary system or GU system and everything and stuff. And that's what that does and stuff. So it causes kidney disease, a stroke. Too much salt can give you a stroke, not just a heart attack, but a stroke. High blood pressure, which is one of the things, can give you a heart attack, but also it can give you a stroke and kidney disease, stroke, and this thing called edema. If nobody knows, that means that your feet has never swollen up on you where it looked like two golf balls down there, the foot or the ankle, or all the way up to your knee, sometimes even further than that. Or they even have facial edema where your eyes and stuff can swell up and swell shut, like you just had you a little Mayweather fight and stuff, and he punched you in your face and you didn't get no punches on him or something like that. Or it's a pulmonary edema, which means your lungs have an unusual swelling in them and stuff, fluid in there and stuff, where they're not supposed to have that. They want air. They don't want fluid and swelling and angry and itis, the inflammation and stuff. They don't want that there. So this is where it's all going, and everything. So then the reasons why we have too much salt and get high blood pressure, kidney failure, strokes, heart failure, hypertension and stuff, or high blood pressure and stuff. Fast foods. That's just fast food. I'm hungry now, so I want my food fast, right? Fast foods. Canned foods. So you mean to tell me my green beans ain't really green beans up in there? They process. They probably started off as green beans, but now they something else. But you got on down, you put them on the plate, right? Okay. I'm just saying. Chips and processed snacks. Doritos, I'm gonna tell you, mark Doritos off and stuff. You can put all the other chips on your Lay's or something like that, and all that other stuff, but take Doritos off. No, I'm just playing. All of them. Okay. Frozen dinners. This hungry man, it got a thing that looked like it was supposed to be tried to be a brownie, and then it got a big old piece of fried chicken on there, and then they got some corn, because corn got all the vitamins and minerals that you need in it in a whole day, right? Okay. But anyway, your frozen dinners, TV dinners, um, too little water intake. I ain't drinking no water. What the water taste like? Exactly. That's why I'm not drinking it. Why should I drink something that it don't taste like? It don't taste like nothing. Because you're getting it for the fluid. So it can thin your blood out so that your blood is flowing around. There's not that much pressure on your heart. They mean something. Even for me. Am I guilty of having too much salt? Yep. Yep. So what? We all guilty, but can we change? Okay. So symptoms that you got too much salt in your body. Swelling in the legs and feet or face. Um headaches, high blood pressure, shortness of breath, you can't catch your breath and stuff, excessive thirst, you're thirsty, and stuff. The treatment, that would be low sodium diets. You got to start no adding salt, blood pressure medication, and getting regular checks, exercise, losing some weight and stuff. It doesn't matter. Don't judge you, don't judge nobody and stuff. Because some people need to gain weight and their blood pressure is high and stuff. Drinking enough water, an adequate amount of water. Okay. What is fats? Fats are nutrients that store energy and help protect organs. Your skin is an organ, your heart is an organ, your kidneys are an organ, and so on and so forth. Now you know that your lungs are an organ and stuff like that and stuff. So it protects the organs like those and stuff. It builds hormones. It helps you have the hormones that make your body rhythmic together and stuff. You need hormones, certain hormones, or you would die, and stuff. That's why they have hormone replacement and everything and stuff. Because we get low on hormones the older we get. It supports the brain. It helps you absorb your vitamins correctly. Ain't no sense in taking no vitamin C and no this and that and vitamin K and vitamin B and B plus and B18, 19 or whatever and stuff if they're not going to even be used, and stuff like that. I noticed that didn't come over here. Ooh, ooh. They is cold. Them is flying roaches. I looked it up and stuff. It said that they're not roaches and them is two different things. But gnats are flying roaches, fruit flies, whatever you call them. And they play or hate around your fruit. But anyway, types of fat. There's healthy fats, avocados, nuts, olive oil, salmon, and seeds. There's unhealthy fats. That's fried food, trans fats and stuff. You can see it on the back of the labels. Processed meats. That's your lunch meats that you think, oh, I'm going to give me some honey ham or some so-and-so and stuff. That's what got it in there. Turkey. Smoked turkey, lunch meat and stuff. They all are processed, so they're no good for you and stuff. But I'm just saying, I hate to be the bearer of bad news. Your deli sandwiches and all of that stuff, everything and stuff. Excessive butter and fast food grease, like frying your French fries, and it's still unhealthy. Oh, McDonald's, they make theirs different and stuff. Yeah, different with that same nasty grease and stuff. Believe me, it's bad and stuff. The pros of healthy fats would be protecting your heart, supporting your brain function, and things like that and stuff. They improve your skin health. They help you to absorb vitamins like your vitamin A, your vitamin D, vitamin E, and vitamin K. These are all things you need, and stuff. And it helps you to absorb them. So you're not taking them for nothing and then just pooping them out or peeing them out and stuff like that. And it keeps you full longer. Healthy fats and the bad fats, they cause these top illnesses. They clog your arteries, which is called coronary artery disease. You get high cholesterol. Nobody wants high cholesterol. That's why they want you to eat your Cheerios and all of that. They're heart healthy and stuff like that. That's where that comes from. Too much unhealthy fat makes you fat. Unhealthy fat makes you fat. That makes you big, bigger, and stuff like that. So that's a bad thing, in my opinion. and stuff. It also causes a gallbladder disease. You need your gallbladder, but if you have to have it taken and stuff, it causes the disease that leads to that and stuff. And then another one, it causes pancreatitis, inflammation of your pancreas. And your pancreas is an organ that produces digestive enzymes. They help you digest your food. It's important to have, the enzymes that it has and stuff. And if they're gone, you got to take supplements to make up for it. You got to take some in the means of that and stuff. So that's where that comes in. It's important. The risk or the causes of getting sick from it is your fried foods, smoking. It's in your genes, so it's genetic. Processed food and lack of exercise. Symptoms that you might faith around and find out because you had too many unhealthy fats. Chest pain and burning, weight gain, a nice amount, significant. You bigger than you used to be. You can't fit nothing, and stuff like that. Fatigue, extra tired. Not just tired like a normal tired, but you even tireder than that and a little bit more and stuff. Shortness of breath, okay? And high cholesterol levels. We don't want high cholesterol levels because we're going to have a heart attack. It's going to clog off sooner than later and stuff. So, that's a problem and stuff. So the treatment for fats, unhealthy fats, a healthy diet, watching the kinds of fatty foods that you put into your body. Only healthy fats like the avocados and olive oil, cooking with olive oil, not vegetable oil, and so on. Cooking with butter over margarine because that's still vegetable oil, and stuff. Trying to taste or imitate butter, and stuff like that. Exercise. These are treatments. Cholesterol medications, a storvastatin, a something statin. That's what that comes from. Lipitor. Lipid means fat. So Lipitor is a storvastatin, I think, if I'm not mistaken and stuff. So that's what that is. A cholesterol medication. Weight reduction. It's always going to be weight reduction, but don't get it wrong. Skinny people can have the same problems, but worse. Because they don't even have nothing to work with, and stuff. You already skinny, which is one of the main problems, because it's usually somebody that's bigger and stuff like that. So what is your problem? You got to do a whole lot of changing of your whole lifestyle and stopping smoking. The smoking just keep popping up and stuff. So this is bad. And then I got to do this for you guys, and then I'll end it with this. But what are electrolytes? Electrolytes are your minerals carrying electrical charges that help your body function properly. There's major electrolytes that you need to be aware of that are good for you and stuff, and that you really need to pay attention to. And that will be your potassium, your magnesium. These all make sense and stuff. They'll make sense to you when you go to the doctor and they take your blood and you like, they gave me a shot and took some blood from me and stuff. This is what you want to look at. Your potassium, your magnesium, your calcium, and your sodium. And these control your heart rhythm, how your heart beats, if it beats proper or it doesn't, muscle movement, and throughout your whole body is muscles. You won't be able to function and everything. Your hydration, so it makes sense in that area. And then your nerve signals. If they all doing bad and everybody got sciatic, everybody got this, everybody got neuropathy and stuff like that, that's not good. Because once you get it and stuff, I think it's really, really hard to even settle it down. Because when it want to roar up like a lion, it's going to do exactly that. So that's where that comes in at and stuff. So potassium, that's one of the biggest ones. I know we hear about it and stuff, but nobody wants to really pay attention to it. But potassium is one of your major ones. If you don't have enough, your heart beats crazy before it stops. If you have too much, your heart beats crazy before it stops. And if your heart stops, you don't live. So it's that important. So that's potassium. It supports your heart rhythm. It prevents muscle cramps, Charlie horses that you get in the middle of the night because they never happen when you could get to the doctor heck of quick. They happen in the middle of the night when you get up and take that middle of the night pee, and stuff like that, and do things like that. It helps your nerves function properly and it balances your fluids. This is potassium. And foods rich in potassium. That's your bananas, your spinach, your potatoes, your oranges, and your beans. But I want to give you a fun fact while I'm talking about potassium because I did take the time to write this down. And that is it takes 4,700 milligrams of potassium a day. That's what you need. So that would be like eating 10 to 11 medium-sized bananas to get 4,700 milligrams of potassium. Ain't that fun? Y'all, you don't just eat one banana. Like I gave all the kids a banana with their breakfast and stuff. No, they need about 6 or 7 of them for kids, and for adults, you need about 10 to 11 medium-sized bananas, the whole thing and stuff, in order to get enough potassium. So here goes your supplements. Hello, supplement. Okay. And same thing with spinach, potatoes, oranges, and beans. You know how many oranges you got to eat to get your real 250 milligrams of vitamin C? Because that's all your body will process in 45 minutes. So if you took 1,000, you just did yourself a disservice and probably blew out your kidneys and stuff, that type of stuff. Low potassium, also known as a hypokalemia and stuff. It causes vomiting, diarrhea, um, uh, diuretic like a water pill, like Lasix or something like that, and poor nutrition. And the symptoms is muscle weakness, heart palpitation. That means that your heart ain't beating right and stuff. Fatigue, extra tired, constipation, and leg cramps. I'm gonna take you until 8:30 and stuff, and I should be able to finish before then, but just in case and stuff. So just giving you a fair warning and everything. And so then high potassium. That's, remember I said it's dangerous if it's high, your heart can stop. If it's too low, your heart can stop and everything. So then that would be dangerous because it'll cause a bad heart rhythm, which means you're doing too much and everything. And the symptoms is weakness, numbness, irregular heartbeat, and chest discomfort. My it's beating out of my chest. Your magnesium. You need the magnesium. They all work together. So you got to have not only potassium, but you need your magnesium. You need your calcium. You need all of these to work together. Your sodium, your sugar, your good fats, and all of this stuff. They all got to work together and stuff. So your magnesium, the benefits is it helps the muscles relax. Your heart is a muscle. It needs to relax so it can keep beating properly. It got to get a rest period somewhere in there and stuff. Not to stop, but just to rest, and stuff, and not work so hard and stuff. So it helps the muscles relax. It supports sleep. It can actually help you sleep good. And it supports your heart function and helps your bones. We need our bones to work and stuff like that. Foods rich in magnesium would be your nuts, your dark leafy green vegetables, your whole grains and beans, and low magnesium. The symptoms is muscle twitching. Don't sleep on that. If you ever got that sick to where you missing a lot of stuff, don't sleep on that, because diarrhea causes you to lose your magnesium in your body too, that you need for your muscles. So it does muscle twitching when it ain't enough in there, anxiety, weakness, irregular heartbeats, and hand tremors, period, and stuff. You need your calcium because it builds strong bones. Calcium is good for you. It's good for your bones and your teeth and stuff. It helps your muscles contract. So it's also good. And what is your heart? A muscle. Is it important? Yep. And stuff. So and it's important for the heart. And that's calcium. Foods rich in it will be your milk, your cheese, your yogurt, your broccoli and sardines and everything. A lot of people put that to the side and stuff. I put that in my little two-pocalypse, my little emergency kit, sardines and stuff, because you might need them and stuff. You got to put something away and stuff. What else? Low calcium will give you muscle spasms. It will cause tingling in your hands and feet. It will give you weak bones, confusion, and even in severe cases, seizures for low calcium. And also, it's linked to problems like osteoporosis. That means looking like SpongeBob, a sponge, but your bone's supposed to be a solid bone, not have pores in it. So osteoporosis, osteo's bone, porous means like a sponge with all them little holes all over the place. You're not supposed to have a sponge. You're supposed to have a nice, strong, healthy bone. That's a problem, and it causes cardiac arrhythmias or crazy heartbeats and stuff. Some you'll know if you have it, if you ever had it and stuff. And the most common electrolyte imbalance risk are the age groups, are your elderlies, your athletes, because you lose it because you sweat it out. You sweat it through your pores and stuff like that. So under elderly is the athletes, because you lose so much. That's why they got Gatorades and water and hydration and alkaline water and electrolyte balanced waters and all of that stuff. That's where all of that stuff come in at. But also kidney disease patients and stuff who are at high risk for problems and electrolyte imbalances. People with vomiting and diarrhea, because you vomit or diarrhea magnesium and potassium and you lose those. How you putting it back? You throwing up. You see what I'm saying? So it's a problem, especially if we're going for a lot of time and stuff. ICU patients, intensive care unit patients and stuff, heart failure patients, and people on diuretics like the water pill, the Lasix, the hydrochlorothiazide, all of that stuff. That's where that stuff comes in at and stuff. When should you call 911? And then I'll give you the conclusion. And that is if you have chest pain, if you have severe weakness, if you notice that you're confused, call a popo, call an ambulance and stuff. Fainting, severe dehydration, your heart beating out of your chest and then it's not. It's barely beating and all of that stuff. The rhythm is off. Severe swelling, trouble breathing, because you feel like you're almost ready to drown. That means you got fluid overload. It's too much fluid on you and your body is not processing it. And seizures and stuff. So those are 911 worthy and stuff. So prevention, healthy habits. That would be reading your food labels, drinking water regularly, eating more fruits and vegetables, limiting processed foods and stuff, even if they taste good. Lunchables. But anyway, exercise regularly, monitor blood pressure and blood sugars, know your numbers, get your lab work done like the doctor tells you to. And then the take home message: sugar, salt, fats, and electrolytes are not the enemy. The real issue is imbalance. Too much or too little can harm the heart, the brain, kidneys, muscles, and blood vessels. The body gives warnings long before major illnesses develop. Swelling is a snitch. Fatigue is a snitch. Muscle cramps are a snitch. Charlie horses are a snitch. Excessive thirst is a snitch. Your labs may expose what your symptoms hide, just in case you don't catch on to it and stuff. Your labs will expose it. And the conclusion: your body operates like a carefully balanced machine. Sugar fuels it. Salt regulates it. Fat protects it. Electrolytes stabilize it. But when the balance is lost, illness will happen. Many chronic diseases, that means over long periods of time, many chronic diseases developing in America today are connected to poor nutrition, processed foods, dehydration, not drinking that water, including, but anyway, and unhealthy lifestyles. Prevention starts with education and awareness. The sooner we listen to the warning signs, the better chance we have to prevent serious illnesses before it becomes life threatening. And my final quote: your body's a snitch, believe it. Every craving, cramp, swelling, headache, palpitation, that means irregular heartbeat, and lab abnormality is your body trying to tell you something is wrong. Listen before the whisper becomes an emergency and it starts screaming at you. It's going to take you down. Thank you for listening to me. That was really something that I had to get that out. So I went over a little bit on you guys and stuff. But the biggest thing is I want to make sure that y'all know why I'm coming on here. I'm not coming to play. I do like to be kind of comical sometimes and stuff like that. But if you go back to any of my old lives and everything, and you watch what I do and watch what I talk about and stuff, you can find a nugget on there. It might not be walking down your street and delivering mail to your address to you and stuff, but it might do it for your family member, for your friends, for people you care about and stuff like that. So it still matters and everything. And if you took the time to listen to this over anything else you could have been doing at this particular time on a Tuesday and stuff like that, at least you have the want to try to do better and stuff. And that's all we need to do is try to do better. We're not going to get this perfect. That's why it's still sickness. That's why it's life. That's why it's death. But remember, all that stuff is a part of being born, because you will die, and stuff like that. How soon you gonna let you die? Your family member, your loved one, your mother, your father, your kids, your auntie, your uncle, your cousin, your whatever, your neighbor, and stuff, and the people you care about. Start thinking about that and stuff when you're doing this, and find things of substance that'll help you when the going get tough. I remember she said this, or I remember she said that, because I'm being a little stingy, because when I do teach on this stuff, I'm teaching to make sure that I treat myself too, that I take care of myself, because I can go just like you, just like your doctor, just like your whoever, and stuff like that. So at the end of the day, if you're going to put something in, at least try to find yourself putting in more things that will benefit your life over the long run than over the short run. You can tag, or share. When I get off, maybe about 3 minutes to 5 minutes later and stuff, you can watch the replay for anybody that came in late, or not late, just at the time you came in and you didn't hear the first part or whatever and stuff like that and stuff. Nobody is in trouble. Nobody has to say I'm present right now at this time and stuff. But it would behoove you, even if you don't watch it while live and you don't want to have the going back and forth with me and stuff, just watch it, alone with your family or something like that, afterwards and stuff. It just won't be interactive. And I thank everyone that took the time to come on, stay on, get something out of this. I hope I did help you and everything. And just remember, it's filming, or is streaming via live feed via Facebook under Charlene Nurse Allen, made public, so anybody can get on and stuff. But also on YouTube under Medical Talk in Layman's Terms with Nurse Charlene. You could find this live and all the other ones before it and stuff. And you could go back and catalog and pick one and stuff, and just absorb some of it, and everything and stuff. Because each of them have a little special place or a special part, and it might be special just for you and what you're going through right now and stuff. I talk about everything: your mind, your body, your spirit, your soul, and everything and stuff. And I'm looking to bridge that gap between everyday people in healthcare. We got to start being able to pay attention to them. They're not getting these jobs as doctors and surgeon and all of this stuff for nothing. and everything. And just take the time to put you first. And that's all I got to say about it and stuff. Y'all, thank you guys for coming on. I appreciate each and every one of you, everybody that participated, everybody that just said hello, and stuff. I appreciate you. And Rosie Grandiala said, your body is telling on you. Believe it. Real talk. Amen. Powerful. Thank you. Thank you, Granny. And stuff. I love you. That's my mama and stuff. She was so um not stingy that she allowed me to go and do podcasts while taking care of her, and we was sitting up in the hospital day after day after day and stuff through a whole cancer bout and all of this stuff and everything. And she sent me and kicked me out the hospital literally so that I could come talk to you guys and help you guys and stuff. Thank you, cousin Maria. She said thank you. I appreciate each and every one of you. Put yourself first and your family and loved ones, because just because you pick this up, it might not happen tonight, it might not even happen next week, but one day you gonna know something that you didn't know before this, and that's that part, and stuff that helps. And Auntie Rena said, have a blessed night, and you do the same, and God bless you. And thank you guys for coming on. I love all of you, and y'all take care, okay? And take care of yourself. Put you first. Okay. Bye bye.